16-year-old phenom Pat Shahgholi absolutely obliterated his opponent's knee in a split second at the recent Eddie Bravo Invitational, leading to a lot of appropriate discussion about the safety of something like this. Welcome back, everybody. I'm Dr. Brian Sutterer, and if you're new here on this channel, I talk about sports injuries and sort of the underlying anatomy and mechanisms. So if that kind of thing interests you, then please be sure and like this video and subscribe for all future updates. I'm far from an expert on grappling and jiu-jitsu, and I certainly don't practice them myself, but I feel like I understand enough about it to know that you want to submit your opponent, not necessarily impart a move that is going to cause them to be injured. A heel hook like this done so quickly and so forcefully, to me, doesn't give the opponent a fair chance to tap and submit. But more on that later on. Let's first walk through the anatomy and just what level of damage something like this can cause to somebody's knee. We have to start by understanding the rotational position of his competitor's left leg. Now, you'll see right here we get a clear view of the bottom of his foot, and so his left leg is a little bit frog-legged out to the side. The foot is a little bit in a neutral, maybe pointed externally position. As Shahgholi then sort of continues this move, we'll still see that the foot is neutral to a little bit forward, maybe externally rotated, but then as he goes into this heel hook, he continues to externally rotate the heel even more. So this position here, focus on the heel right there, notice that it swings up this way. That's going to externally rotate the heel, externally rotate the tibia or the shin bone, and so we have to think about what damage that's going to cause up at the knee. So here we go, we see that heel swing outward, the foot and the tibia continuing to externally rotate, which obviously sets up why this is so damaging. Now we can see that his competitor's foot is completely rotated 180 degrees, all right? This is not some subtle slight rotation. This is like almost a full 180 degrees rotation of the tibia, which is certainly beyond what it's supposed to do. We can see the toes pointing back, the heel is up, and remember the knee is still facing upwards in this direction. It's a little deceiving here because it looks like the knee is maybe hyperextended, especially as he continues to kind of pull on it. We can see a little bit of the outline of the gastrocnemius muscle, and you almost get the sense that there's some hyperextension, but if you look at a different angle, you'll see that the knee was actually flexed. Now rotating to this angle, we can again see that sort of frog leg position of his competitor's left knee. Realize too, in this position alone, you'll tension the lateral collateral ligament that sits here on the outside of the knee. This is a common injury for wrestlers, and it's in this position where their knee is a little bit bent, gets forced into this varus load, and you pull on these lateral structures, potentially injuring your LCL. You can actually feel your LCL oftentimes if you sit in this figure 4 cross-leg position and sort of palpate on the outside of your knee. You'll feel a thin little cord. That's your LCL. So remember, the foot and the tibia are going to be externally rotated here. So initially everything's in a nice neutral position. But as he kind of continues through the positioning here, you'll see how that foot and the tibia has now been completely externally rotated. And we're starting to catch a little bit of glimpse of something here that looks like a patellar dislocation or a dislocation of the kneecap. We can see as it continues through, now there's this clear kind of bony deformity step off where we see that outline of the kneecap because I suspect it's been dislocated. And again, we catch this full 180 degree rotation of the tibia where it's completely rotated backwards in that complete excessive external rotation. The foot should be pointing up this way. It's completely swung around in this direction. But you'll notice the knee is not hyperextended. It's in a little bit of flexion here, which also explains the subsequent damage. His competitor then looks like he grabs the inside of the knee, and as we'll look at our anatomy model, that's going to be where the ligament that helps sort of anchor the kneecap sits. And so if you tear that ligament, you're going to have a lot of pain on the inside of your knee. It's hard to even know where to start with the anatomy and possible injuries here because something like this could completely obliterate and dislocate your knee. I mean, this is potential for a major like life-altering injury. First of all, recognize that difference between extended and flex. So when the knee is straight or fully extended, there's this screw home mechanism of the knee that comes from the different contours of these bumps in the femur, where whenever you go to straighten your leg, that last little bit of straightening, your tibia or femur, depending on if it's closed or open chain, actually rotates. It rotates to sort of lock the knee into place. So that means whenever your knee is fully extended, it's essentially locked. You're not going to normally get any internal or external rotation of the shin bone when you're fully extended. But when you're flexed, meaning a little bit of bend in the knee, you do have a little bit of internal and external rotation play in the tibia relative to the shin bone. So because this left knee is flexed, that allows to apply that initial rotation in the external direction to further stress the ligaments. if the leg is completely straight, you're not going to be able to rotate the tibia to stress those ligaments. You're going to stress other things by hyperextending it, but you're not going to get the same type of rotation as you will when the knee is flexed. So the fact that it's flexed allows Shahgholi to initially start that rotation. The main restraints to external rotation of the tibia, and again, when we talk about external rotation, we mean going out this way, so spinning the tibia outwards, are going to be these structures primarily up on the posterolateral region of the knee. We call it the posterolateral corner. It's a very complex region of anatomy. Not everything is shown here on the model, but it's all these little ligaments and structures that help to stabilize a lot of the rotational stability of the tibia. One of the key structures is this oblique popliteal ligament that runs and is a little bit thicker on the back of the knee. But you can imagine how with this structure, if you take this portion of the tibia and you rotate it this way, you're just going to pull that oblique popliteal ligament. You're also going to stress this LCL and all this posterolateral corner. The PCL, which of course sits inside the knee and is sort of analogous to the ACL but in the opposite direction, is also important for resisting that external rotation. So you also run the risk of these cruciate ligament injuries when you have this severe of a forced external rotation. I mentioned how it looked like a patellar dislocation. So here we have our kneecap, patellar tendon, quadriceps tendon, and what's also on our anatomy but not shown on this model here is a little ligament that runs right here called the MPFL, the medial patellofemoral ligament. It's kind of the seat belt that keeps the kneecap in place. What you're basically doing when you externally rotate someone's tibia is you're taking the insertion site, the tibial tuberosity, and you're swinging it out in this direction to basically pull that whole tendon bone complex in the direction that the patella typically wants to dislocate. Usually when the patella pops out, it goes lateral. So by rotating the tibia externally, you're just helping to basically push that kneecap out of place. Of course, that can lead to tearing of that MPFL ligament and significant pain on the medial aspect or inner aspect of the knee. So if we walk through all this one more time, remember the left knee is in a flexed position. The foot and subsequently the tibia are a little bit externally rotated here. As Shahgholi kind of continues to rotate and apply this heel hook, the foot and the tibia get externally rotated even more down here, as we can see with the heel swinging up, the toes coming down. And what that's going to start doing is applying tension to those posterolateral structures, the PCL. It's going to pull the tibial tuberosity, the insertion of the patellar tendon out laterally, making it more likely to sustain a patellar dislocation. And it all happens so quickly that I don't feel like there's really a fair chance for the opponent to tap and submit. And that's kind of the crux of what a lot of the discussion is on the internet about this whole sequence. Now, I'm not in any way an expert or understanding of all the rules and sort of ethics of the sport with grappling and jiu-jitsu, and I know there's a lot of controversy out there about this, and I think this injury in this video should highlight that the damage can be very, very real. I think we understand the severity of like head trauma with boxing, but these severe joint injuries can have just as much a long-term disability as something like a head injury. It's just going to be in a different way. And we see it, I mean, even the announcers on this broadcast, we're talking about how there's no time. It's basically, they said 0 to pre-op, implying that there's no chance really to process what's happening, tap, and then allow your opponent to stop applying the pressure. And that's personally my concern with this. You know, I know he's a young guy. I hope someone encourages him and kind of gives him the guidance that you don't need to apply that much pressure. I know it looks good. It sort of gives you this, you know, nickname and sort of persona within the sport, but I don't think it's necessary. I think you can be just as skilled, and I'd argue show more skill by having the restraint to know when you've reached the limit and allow your opponent to have the chance to tap. I know it might seem like some people have rubber bones, but realize that when you apply these submissions, yes, you might be winning that single bout. There might be a lot of money on the line, but you could be having a life-altering effect on that other individual, which I think everybody in the sport doesn't truly want to maim somebody and disable somebody for the rest of their career. So I think he's young. Hopefully there's someone who's kind of in his ear giving him some guidance to understand what the limits are of some of these submissions and have some more understanding of what damage you can truly impart. This isn't just a mild knee sprain. This is something that can truly result in significant disability in an athlete. And yes, athletes are accepting that risk when they step into a sport like that, but I still think there needs to be a little bit of room for some give and take and sort of some understanding that you're not going to try to ultimately have the kind of worst case outcome. Let me know down below what you guys think. There's probably gonna be people who watch this that practice grappling or jiu-jitsu and maybe have a different opinion about everything. Hopefully this explanation of some pretty complex anatomy and biomechanical movements was interesting and helpful to understand what happens with a heel hook submission like this. But yeah, let me know what you guys think. I'm curious to hear everybody else's opinion. As always, thank you very much for watching, and I'll see you in the next video. Bye.